Well, like a number of European countries, Germany has been hit hard by this pandemic. There's more than 72,000 confirmed cases of COVID-19 in Germany, but less than 800 people have died. That is far less than the thousands who have died in Italy and Spain.
So the question becomes, what could be contributing to Germany's low mortality rate? CBS News journalist Anna Noryskiewicz is taking a closer look at the country's response, and she's joining us from Berlin. Nora, I just want to make sure that I got your name right. I apologize if I didn't.
It's Noryskiewicz, but that's okay. Nice to be here. So
Okay.
It is, in fact, remarkable when you compare the numbers. When you look at the death rate in Italy, which is now at about 10%, and here in Germany, we are still at less than 1%. But it's important to say that, or important to stress that the number will rise. The main difference is that the outbreak here in Germany started mainly among younger people returning from skiing holidays in northern Italy and in Austria. So the widespread testing also started among young people, which means that people with mild symptoms and mild cases were included in the statistics, which means that the number of infections was high, but compared to the mortality rate, fell proportionally. So this is the reason number one, that the median age of the infections and of the people who are infected is different. It's much higher in Italy, where it's about 63, and in Germany it's 47 now. So this is important that when we look at the statistics, we have to keep in mind that we can only compare them to a certain extent. And widespread testing is definitely one of the main reasons. Here in Germany right now, we are testing up to between 350 to 400,000 people a week. Which would make around 50,000 a day, though politicians say that we technically have a capacity to test up to 200,000 people a day. So as I said, in the statistics, there are people included who have really mild symptoms. And when we compare to Italy, there was the case that when they started testing people, it was mainly people who were older and who were already admitted to hospital with stronger symptoms.
No, Anna, here in the U.S., many people are practicing social distancing and, are staying at home, but many aren't. There's only a handful of states, less than half of the states, that have sort of statewide stay-at-home orders. It's really a patchwork going on here. In Germany, when it came to social distancing and staying at home, shutting down non-essential businesses, how was that implemented? And, do authorities there think that has had an impact on the spread of the virus and, more importantly, the death rates?
Yes, definitely. So experts say that Germany took the measures early enough, or quite early. So we closed schools 2 weeks ago, and daycare facilities, and basically all non-essential businesses. So all restaurants and cafes and stores, and people work mainly from home. So the social distancing measures work out quite well. We have to say that we are not on a proper lockdown like it is the case in Italy or in France. We are allowed to leave the house, but we can't obviously spend time in bigger groups than, well, 2 people. So, but you can still go to the park, and you can work out, and you can go do your groceries and go to the pharmacy without having to present a piece of paper like you do in Italy, for instance. So people are taking these measures quite seriously, because they know that right now it's about gaining time and making sure that we don't overwhelm the healthcare system. So people are aware of that. And as I said, experts say that Germany took the measures just in time.
Is Germany providing help and assistance to other countries within the EU, Nora?
Yes, so this is one quite interesting point, that at this point our healthcare system is stretched, but it's not overwhelmed, I'd say, yet. So we can assist other nations, and we do this in form of showing European solidarity, that we take patients from France and acute cases from France and Italy, and we treat them in hospitals in Germany. And it's also important to say that compared to other European countries, Germany has a very well-equipped healthcare system. So we have around 28,000 intensive care beds. If you compare it to Italy, Italy only has 5,000. So Germany is quite well prepared. We have around 1,900 hospitals, and then another good number of military hospitals, and around 450,000 hospital beds in total. 100,000 are currently empty. So we are well equipped and also well prepared, because the healthcare system and healthcare facilities took preemptive measures to make sure that the healthcare system is not going to be overwhelmed. So, for instance, nurses are trained to look after and take care of COVID-19 patients. Then operations which are not as necessary now, which can be postponed, are being postponed. So there's a huge number of operations that will not take place just yet. And generally, we have a well-equipped healthcare system. So this is also one reason why I think we're handling, or Germany is handling, this situation quite well so far.
It's the old adage that we're seeing sort of unfold in real life. An ounce of prevention is worth a pound of cure. Anna, thank you so much for giving us some insight into what's happening in Germany.
Thank you. Stay safe.